So afternoon, everyone, and welcome to the second webinar in our GroundsWell Early Career Researcher and Partner series. My name is Niamh O'Hagan and I'm going to be chairing your session today. I'm part of the GroundsWell team based at Queen's University Belfast. So the series of webinars that we're doing really came about because in GroundsWell we have a good number of early career researchers who are working across a lot of different disciplines using different innovative methods, and we really wanted to highlight the breadth of this work being conducted by our early career researchers, or our ECRs. But beyond just our ECRs, we also have fantastic partners across the GroundsWell Consortium who we are working with to develop and produce meaningful community engagement and community-based research. So this series really serves as an opportunity to highlight their areas of expertise as well and spotlight some of the work that they're doing across the UK too. So as you can see, hopefully on the screen, today's session, we are taking a closer look at systems thinking and partnership working, specifically looking at it through the lens or within the context of the research that we're leading on in Queen's on preventing violence against women and girls in outdoor public spaces. Our two fantastic speakers today are Sophie and Jacqueline. Dr Sophie Jones is postdoctoral research fellow based at Queen's University Belfast, who is leading on this work on the violence against women and girls in outdoor public spaces piece. And we have Jacqueline O'Hagan, Healthy City Coordinator with Belfast Healthy Cities. They'll be partially reflecting on being part of this work, but really also highlighting some of the work of Belfast Healthy Cities, which is driving us forward in preventing violence against women and girls in outdoor public spaces. So before we begin, just in terms of format for the session, our speakers are going to talk for around 15 minutes each, and then we will have time for questions and discussion. You can put your questions or comments for the speakers into the chat at any time. If you want to introduce yourself in the chat at all, also feel free. If you, at the end of the presentations, would like to unmute and ask a question or speak to our presenters about something we presented, as I say, yeah, if you could do that at the end of both of the talks, that would be helpful. And I think possibly due to the setup of the webinar, you might need to request to unmute, but as long as you hit that, then I can make sure that you're on okay. So without further ado, I think I'm going to hand over to our first speaker, who is Sophie. Sophie, if you'd like to share your screen.
Thanks, Niamh. Just share my slides. Can you see my screen?
Yeah, looks good.
Okay, thank you. Hi, everyone. As Niamh mentioned, my name is Sophie and I'm a researcher, part of GroundsWell, based at Queen's University Belfast. And I'm going to be presenting some work we've done building a systems map with partners as part of our Preventing Violence Against Women and Girls in Outdoor Public Spaces work. I'm going to be talking a bit about the actual process of developing the map and also showing some findings and also highlighting where you can find more information about the work following this webinar as well. So I just really want to start by acknowledging the research team that's part of this this piece of work. So the team is led by Professor Ruth Hunter and Dr Claire Cleland, and the rest of us just contribute. So just acknowledging everyone's input here. So just to get started and contextualise the issue of violence against women and girls in outdoor public spaces, this is some stats from some recent research looking at the Northern Ireland context specifically. So 98% of women experienced at least one, sorry, I can't see my slides, thank you. One form of violence or abuse in their lifetime. Experiences of at least one form of violence or abuse were common for ages 11, between ages 11 to 18 and in adulthood, really showing the life course experience of violence. And then 91% of women think that Northern Ireland has a problem with men's violence against women and girls. 90% of women believe that Northern Ireland has a problem with attitudes of sexism and misogyny. And 81% of women believe that there is stigma surrounding issues of violence against women and girls. And all these statistics are from recent surveys and research done with women and girls from across Northern Ireland. And similarly, when asked to recall the location of their worst violent event, 16.4% of women and girls report that these instances, so again, of their worst violent event, take place in public spaces such as public transport, on the street, in a square, in a car park, a forest, a park, or elsewhere outdoors. And then finally, in a survey asking where should prevention strategies be focused, 98% of women and girls reported public spaces, which is the most common answer of all the settings you see here. So hopefully these three slides just contextualize that there is an issue of violence against women and girls, and specifically in relation to outdoor public spaces in Belfast. So this led to us leading on some research, looking at how we can explore interventions to end violence against women and girls in public spaces in Belfast, which is the team I showed on the very first slide. So when we say outdoor public spaces, we're talking about parks, greenways, streets, footpaths, public transports, and public squares. And specifically, we're interested in these spaces because of things like social well-being, mental well-being, physical health, and cognitive health, which we know are benefits from experiencing and engaging with outdoor public spaces. So when women are not able to freely move through these spaces without the fear of threat and violence, not only are they missing out on these well-being and health benefits, but they're also being left outside health benefits associated with taking part in these spaces. So, with that in mind, the overarching research aim is to work with women, girls, and other individuals from key organisations to help design and develop interventions to prevent violence against women and girls in outdoor public spaces in Belfast. And the interventions will inform design of outdoor public spaces, how the public use them, work to change the attitudes, behaviours, and social and cultural norms of people, including men and boys. And specifically, we are looking to incorporate systems orientated approach, which I'll come back to, but specifically to help orchestrate a multi-sectoral, multi-policy action plan that will directly benefit the health and well-being of women and girls through preventing violence, abuse, and harassment in public spaces. So, just on this idea of systems thinking, that's a core aspect of this piece of work. And I just want to explain what that means before I talk about the workshop process. So when we say systems thinking, we're talking about a way of thinking based on these idea of key system concepts. So the concepts I've highlighted on the slide here, but just to talk you through them. So the first concept is acknowledging the number and diversity of factors. So when we're talking about problems such as violence against women and girls in outdoor public spaces and complex problems in general, normally there are a number of diverse factors that interact to shape the problem that we experience. So this brings me on to my second concept, which is the fact that these factors are also interconnected and feedback. So this means that factors are directly linked. So if you think about it in the context of violence against women and girls, thinking about how economic factors are linked with social factors that are linked with environmental factors, and the list goes on. And it's really acknowledging that these factors are linked not in a linear way, but in a circular way. And what I mean by that is it's not just as easy as economic factors influencing political factors. Political factors also has a circular effect back on economic factors as well. So it's trying to understand the dynamics between factors and how it's not just a one directional relationship between them. Thinking about these factors and the relationships or interconnections with these factors help us broaden our perspective in terms of acknowledging the full picture of the problem. So that helps us move from thinking about parts of the system in isolation, so just thinking about the environment or just thinking about economic factors, and more so thinking about the whole picture of the problem itself. And this is helpful because when I'm talking about these factors and how they're interconnected, that's also what we refer to as the system structure. And in order to understand the behaviour, so the problem of violence against women and girls, we first need to understand what is shaping the problem in the first place. And by understanding the structure, we can identify leverage points, which can help us action change moving forward when we're thinking about intervention or policy points for the future. So thinking in this way is beneficial to existing methods for a lot of reasons. So the first is to avoid reverting to linear cause and effect thinking. So I touched on this on my previous slide, But again, it's about thinking about the acknowledging the unidimensional relationship between factors. So it's not one directional, and actually things can link back. The next thing as well is involves this way of thinking helps us avoid, static and narrow mental models. So by thinking about the full picture of factors and how they're interconnected, we challenge our own assumptions about what we feel are shaping the issues that we are trying to solve. So I'll come back to this when I talk about systems mapping. But this way of thinking also helps us avoid relying on silver bullets or quick fixes. So when we're looking at these more complex challenges, it's more often than not relies on a multi-sectoral approach, which will be from more than one area and for more than one organisation. Then this also brings me to my last 2 points, which is consider co-involving reactions and consider unintended consequences. And this helps us think about when we think if we if you have dynamics between factors, acknowledging that sometimes things happen in unintended ways, we can acknowledge that having a mapping out the system and seeing how that is one factor linked to another factor. If we intervene in one factor here, that will be consequently linked to one factor there. So that just helps us avoid unintended consequences, which will help us plan for more sustainable and adaptable interventions and policies in the future. So as I mentioned, we can use a series of tools to help operationalize systems thinking. One of these methods are systems mapping. And systems mapping is a visualization tool used to help us think and be more specific about our assumptions, beliefs, and understandings. It helps us synthesize and connect different types of data, evidence, and information, communicate our mental models, orientate ourselves in terms of understanding, again, the broader picture of the problem and how these various factors are connected, and then also extrapolate from assumptions to implications. So this comes back to what I was talking about, unintended consequences and understanding reactions within the system itself. So understanding if we intervene in this place in the system, so for instance, design of spaces, what other factors is that also going to have an effect from that initial change? So this is just a brief overview of systems thinking and systems mapping. And essentially we use this approach to build a series of workshops with partners. And the objectives of the workshops were to co-develop a systems map with individuals from organisations who have an interest in preventing violence against women and girls, visualising a shared understanding of the physical, social, cultural, economic and political environments for preventing violence against women and girls in outdoor public spaces in Belfast, and then also use the systems map to identify and explore interventions and policies to prevent violence against women and girls in Belfast, what is of value to stakeholders and what is needed to implement actions. So in summary, with these workshops, this was the starting point of this piece of work, and we really wanted to understand what is causing violence against women and girls in order to understand how we can prevent violence against women and girls in outdoor public spaces. And then building on the shared understanding, we asked partners to identify interventions and policies that they believe could be of interest for possible solutions going forward. So for these workshops, I'm just acknowledging our partners. So we had over 30 representatives from the following list of organisations, or at least one representative came to both workshops. So the workshops were done across 2 separate days, on consecutive days of 2-week period. So on the Monday of one week and on the Monday of the next. And they were 2 full-day workshops. And in terms of the actual structure of the workshop process itself, the first workshop was introducing this idea of systems thinking. So this was really trying to encourage partners to think in a different way, perhaps, than what they're used to. So moving away from the linear thinking I was talking about and acknowledging the broad range of factors and broad range of ways that this issue is coming to exist. And then using systems thinking, think about the factors that might be causing violence against women and girls in outdoor public spaces, just to identify what is already happening in the system. And then building on these factors identified by the partners, we introduced systems mapping, and then we built a systems map across a series of groups. So there was 5 different groups, and there was a research member on every group, but the systems map was developed by the partners themselves. So at the end of workshop 1, we had a series of different maps that came from each group. And between workshop 1 and workshop 2, the research team formulated one big systems map incorporating all the mini maps to present back for the second workshop. So this brings me to the process for the second workshop, which was refining the systems map that we created from the first workshop, and just in terms of refinement in terms of the terms we used, in terms of the directions of relationships, just to make sure that we designed a map that was reflective of what the partners had envisioned and designed and what we discussed. And then following this process, we asked participants to identify a set of key actions and priorities for interventions and policy. So very quickly, what we were left with at the end of the workshop was this. So this is the systems map. So when you see the circles, inside the circles are our factors, and the arrows between them just show the links or the relationships between different factors. So you can see that there's various, I guess, themes. So that's what the color coded are. So there's like physical infrastructure, there's attitudes and knowledge, there's political factors, and there's educational factors, and 2 of our main outcomes that what we're interested in as well, and that's health and well-being and preventing violence against women and girls in outdoor public spaces. I'm not going to go through the map. This is available in the report that I'll talk about at the end of the report, but one thing I did want to talk about that was we talked through frequently, in especially in the second workshop, is this idea of feedback loops. So this is just an example of a feedback loop to contextualize the systems thinking slides I did just a while ago. And essentially what you can see here is the dynamic relationship between the fact that if you look at safe design, inclusive and safe design, this links with maintenance of outdoor public spaces, which links with monetary cost of infrastructure, which leads back to inclusive and safe design. Similarly, this money cost of infrastructure links with passive security, which links back to monetary cost of infrastructure. And this just shows you the dynamic ways and circular nature that when we're talking about these factors, that they're not linear, and that many times the structure feeds back on itself to shape our main outcome, which is preventing violence against women and girls in outdoor public spaces. So, as I mentioned, the second part of the workshop was identifying a set of action and priority points. In total, there was 8 action priority points highlighted across 4 main themes. So these were education, design, attitudes and behaviour, and political. And whilst I've just included the title of the action points here, the action points are in the report as reported by the partners themselves. So that is the workshop processes, and I guess what we were left with at the end. In terms of output and dissemination, we led a plenary session at the end of the second workshop to ask what would be useful for partners in terms of disseminating their time and also the work that they put into the research, and they asked for a report. So we went away and pulled the systems map together, did a write-up of the process, did a write-up of the map, of the action points, and we pulled all that together to formulate this report. I think Neve is going to share this in the chat as well. But that was our main output that was we put out the end of March. You can also get from the link there and via the QR code. And then finally, we also did a blog that was reflecting on the process of taking part in systems mapping workshops from my perspective as being the researcher on the piece of work, and that's also available on the QR code and also on the link at the bottom of the slide there. That's everything from me. Thank you very much. and happy to answer any questions after Jacqueline as well.
Brilliant, Sophie, thank you so much. I think that was a really great insight into systems thinking, into systems mapping as a process, and a great example of how you can apply it in coordination with partners, and a really sort of good example of co-development, co-production with a large number of partners across GroundsWell. So yes, Jacqueline, if you want to get your slide ready in the meantime, if anyone has any specific questions for Sophie, please do feel free to put them in the chat and we can pick them up afterwards. In the meantime though, our next speaker, of course, is Jacqueline O'Hagan from Belfast Healthy Cities. Thanks, Jacqueline.
Okay, just checking you can see that okay, Lindy?
Yes, perfect.
Yep, brilliant. Okay, well, thank you. As mentioned, my name is Jacqueline O'Hagan, and I am going to now present from a partner perspective with GroundsWell, having been involved in this process. And I was really lucky to have been involved in this conversation with GroundsWell over the last year or so, both in a previous role and in my current role as the Healthy Cities Coordinator here in Belfast Healthy Cities. I thought I'd start, for anyone who is maybe unfamiliar with the Healthy Cities Network and what that is, with a couple of slides just giving a really brief overview. The Healthy Cities Network was created as a response to a growing recognition, really, that urban environments play a really key role in the health and well-being of our populations. It emerged as a part of the World Health Organization's Healthy Cities initiative way back in the 1980s, and actually, really proudly, Belfast was one of the first cities to achieve this designation, and are still a designated healthy city over 35 years later. There is up to about 100 designated healthy cities across Europe, but the network is much wider than that. There are national networks and other opportunities for cities to become a part of this if they haven't got the resources or capacity to be a designated city. And as you can see here, there are 1,400 cities across Europe that are connected in, and that's a really, really good a group of people in cities that can connect into shared learning and best practice models. Belfast, as a member of the Healthy Cities Network, delivers against the 17 Sustainable Development Goals, which have been directly translated to work through Healthy Cities into a 6P framework. And luckily I don't have to rhyme this off, they're on the screen, but the 6Ps that we work on are peace, planet, place, people, participation and prosperity. Some people who are involved in different strategies and policies across Northern Ireland will be familiar with some of those. There is real synergy across things like the Programme for Government and Belfast Agenda that align to those as well. Healthy cities lead by example, locally and globally, interacting with the planet and key actors and players to create physical, social and cultural environments that are designed to empower and enable all people equitably, allowing them to reach their full potential. Let's see if I can get the next slide. Yep. So how we deliver against those 6Ps is our programme of work. And a key role for Healthy Cities and how we do that is about piloting and testing initiatives. So looking at policy and strategy and how can we really bring that into practical action. And we have a body of 5 programmes here that you can see, and all of the work that we do and develop is done so through stakeholder engagement. So while we're a part of a much wider European network, our programme of activity and our key priorities are done through stakeholder engagement to identify what needs to be really achieved in Belfast. And I want to highlight a couple of these that are really key to the work that we're talking about today. So 2 really big pieces of work that we have are around promoting healthy transport and green in the city, and those directly link into the conversation around safety and safe spaces for women and girls. In a recent article, we looked at this, so I want to just kind of highlight the first P that we have here, which is peace, and you can see how that directly links into safety for women and girls. And one of our colleagues here, Maeve, who may be on this webinar actually, recently developed and put together an article on rethinking urban spaces. And in that, she explored how violence against women and girls can act as a real barrier for accessing our urban green and blue spaces, and how that can really go against achieving peace. It highlighted a few things that probably won't be a big surprise for those of us on the call, that designing spaces from the perspective of women and girls can really help to prompt peace through making spaces more accessible, safe and inclusive, not just for women and girls, but for everybody. As you mentioned, Sophie, in your presentation, outdoor places such as parks and open spaces are really important spaces for accessing nature and all of the health benefits that come with that, but they can often be very male dominated and in many cases can be designed for men. If we think of even for young men, we have bike parks and basketball courts and sports activities that might kind of align more. And if they are also maybe badly maintained or quite dark, it can be very off-putting for women and girls to access those spaces, in which case they might then avoid them. This can lead to less opportunities for women and girls to spend time in those spaces and achieve all of the benefits associated with them, as well as having that connection to peace and safer spaces. As highlighted in a couple of slides ago, we have specific programmes that are aligned to this. One of those is our Green and City Advisory Group. Belfast Healthy Cities are really interested in promoting green spaces and open spaces and the benefits that those have. Really looking at particularly access to, proper design and then proper maintenance of those spaces. We're committed to working with a range of key partners to look at how we can ensure our green and open spaces are accessible to all. The Green and the City Advisory Group has been running for a few years now and has representation from organisations like Queen's University Belfast, who helped co-chair that group, but as well as that we have Belfast City Council, Department for Infrastructure, the Northern Ireland Housing Executive, Public Health Agency and Belfast Health and Social Care Trust, along with other partners. So it just shows how we can bring people together to really have a joined up conversation. People are approaching that with different perspectives, different experiences and different intervention ideas. So it's been really interesting to see that group kind of form over the last few years. On talking about this particular topic, I wanted to flag a few things and a few thoughts that came to my head just initially when we're talking about partnership working and systems thinking in relation to ending violence against women and girls. Firstly, it's really important to mention that this is a very complex issue, intersecting multiple sectors and departments, as mentioned before. Yes, this is something that's really key on the agenda for Department for Justice, for community safety and policing, for example, but if we're looking at it as a public health issue, then obviously it connects into the Department for Health, as well as that if we're trying to redesign or look at the design of our urban green and blue spaces, then Department for Infrastructure is a key player as well, and connected into that is how we move through our city. So it's really important to see that all of this is interconnected, and then how that plays a key role in the larger strategic priority of peace is important as well. This is part of a bigger conversation. I think it's important to note that safety in public spaces is one element, but there's also a huge topic and a huge, really important conversation about safety in private spaces, whether that is at work or in the home. And I think this is something that is a conversation that's happening in different sectors within our work, in our statutory agencies, in our government agencies. And while we are talking specifically about parks, open spaces and public spaces, it's really important to understand where that fits within that wider conversation as well, especially for engaging with stakeholders across both. I'm not going to thankfully go into the topic of systems change too much because I know Sophie did a really good presentation on that, but just to highlight from our point of view as partners that systems change is a really important piece of how we do this work and how we kind of address this. It's about looking at those interventions that have the biggest impact and then, as you mentioned, Sophie, those kind of wider ripple effects that may be unintended consequences of interventions as well, and how we can identify those early on. Being involved with this research piece with GroundsWell has been really interesting and has allowed us to have that conversation in Belfast Healthy Cities and in previous work as well. A collaborative approach is something we do at the core of all of our work. And so we can really see how systems working and how that stakeholder engagement has allowed for a collaborative approach. I was involved in the workshops that Sophie referenced, and it was fantastic to see around 30 people in a room from so many different sectors, whether that was education or health or youth, all bringing different perspectives and different thoughts to this conversation. I think that's what's going to help us come up with some really meaningful outputs. I thought it was really important to mention relevant factual data. As well as being a complex issue, violence against women and girls is a very sensitive issue as well. It can, as soon as we see any incidents happening in our cities, we're seeing those kind of brought up onto a platform and media, which is great because it helps to drive change. But sometimes that can also lead to misinformation that will make women feel a bit less safe. As well as that, with relevant and factual data and evidence collection, we can really ensure that the targeted interventions that we are working towards and putting our resources into have long-term sustainable impacts. And finally, I wanted to mention the importance of shared learning and best practice approaches, and that's something that Belfast Healthy Cities can really lean into, bringing together models of practice that are happening across cities around Europe and the rest of the world. And instead of reinventing the wheel, there are places that have done this. Can we learn from them and can we replicate that? And last year, as a part of this programme of work with GroundsWell, Belfast Healthy Cities did coordinate and deliver a webinar, which was able to bring in some of those actors and some of those players and have a joined up conversation. I think it's really key to have that. I wanted to touch a little bit on how we then engage the community in this conversation. And as mentioned, I was involved in stakeholder sessions that happened earlier in the year and some previous conversations that had happened last year. It is really important that the discussions that are happening at a research level, at an academic level and a strategy level are being informed by engagement with stakeholders on the ground. So to mirror this discussion, at the end of last year, I brought together a group of stakeholders who are within community organisations, people who are working with women directly on the ground who are in crisis, people who are in community safety and policing and neighbourhood safety teams. And it was really interesting to have this conversation with them and understand how the issue affects them, because as I mentioned on my slide there, this is an issue that will affect people differently based on how they're engaging with this topic. Me, coming from the organisation I'm working in, will have a different perspective than somebody who's working with women on the ground who are struggling. So it was really interesting to have that conversation and hear from those people, and then use that to inform the conversations I was having. And I know that Queen's and GroundsWell are planning to have a citizens jury next, which brings together local people to have this discussion and perhaps facilitate systems thinking at that community level. And I think that's really interesting, and I'll be really interested to see some of the outcomes of that. So bring onto a piece of work that we are now working on and that will be happening later this year that kind of continues that aim of engaging with communities. Belfast Healthy Cities will be delivering a pilot programme later this year looking at the place standard tool. Some people may be familiar with this or might not, so I'm not going to go into too much detail on it, but I wanted to give a bit of an overview. The place standard tool provides a simple framework and a structure that allows for conversations about place based around how that impacts on our health and well-being. It was developed by Public Health Scotland and can be used as a part of a series of public consultations or one-to-one settings. The tool itself is built around 14 themes, and these can be everything, and they're all up on the screen there, but it can be everything from public transport, feeling safe, and our streets and spaces. They cover a broad range of both physical and social characteristics that make up our spaces. But basically, you would use this tool as a method of going through all those 14 themes out in your local environment and asking questions to assess how your environment and how that space really measures up against those themes and topics. This tool in recent years has been developed through specific themes, so allowing people to have to use this framework to have conversations through specific themes, whether that's climate change, the environment, or how we design spaces for children and young people. And really excitingly, this year, Public Health Scotland are redeveloping the place standard tool to have it used through a community safety lens, and they're piloting that with 4 cities across UK, of which Belfast is one. And we are taking a particular focus on this through the lens of violence against women and girls. So can we pilot the place standard tool here in Belfast to take a practical approach to assessing our urban green and blue spaces through the lens of safety for women and girls? What does this look like? In August, there will be a webinar that Belfast Healthy Cities will deliver. And if anyone on this call is interested in hearing more about that, we will be able to share that with Niamh. But this webinar will take a really deep dive into what the place standard tool is, how it's being developed to look at community safety, and how that then links into the topic of violence against women and girls. Following that, myself and a couple of colleagues are going to head over to Glasgow in August to actually take part in training to allow us to deliver the place standard tool through the community safety lens. We'll take that training back home with us, and then in the autumn we plan to deliver a practical pilot project in North Belfast in the car zone there. So working with some of our community champions, we will deliver a series of workshops in their parks and open spaces to assess those areas for safety and how people feel safe, what would be possible interventions or possible ideas that they would like to put forward to change those spaces. All of that information will be gathered into a report, and hopefully later down the line we would like to deliver that training to a wider group of stakeholders in Belfast so that other people can use this method and approach in their own engagement. And finally, we will be presenting that to Community Safety Scotland conference in Scotland next year. That is everything I have. It was quite a lot and a bit of a whistle-stop tour through different topics. So if anyone has any questions, feel free to get in touch.
Brilliant, Jacqueline, thank you so much for that presentation. I think it's really interesting to hear at the beginning how you outlined how the WHO Healthy Cities framework can be applied to this problem, or I suppose within the context of violence against women and girls in public outdoor spaces. And great to hear those examples as well of partnership working and systems thinking and community engagement with Belfast Healthy Cities, and they do it so well. I really liked something that you said. I actually wrote it down when you mentioned about how the GroundsWell research has to be informed by stakeholders on the ground. And I think that really sums up what we're kind of talking about today, and actually sums up the ethos at the core of GroundsWell, which is that we want to make sure that our research is informed and produced through that co-development process. We have two questions, I think, that are directed to Sophie's presentation, so I'm going to pick on her first. But if you have any questions that come out of Jacqueline's presentation, please do feel free to put them in the chat and I can pick them up. Or indeed, if you want to unmute, you can hit request unmute and I can get you out speaking as well. Sophie, the first question that we got is from another Sophie, asking, was there anything that surprised you during the workshops? So did you hear any suggestions or perspectives that you hadn't thought about before? And I think that's a really great question to reflect on the process.
Yeah, thank you very much, Sophie. I think that the interesting, I don't think it was surprising, but it's always just interesting, is the process of getting different partners and stakeholders together that work with different people. I know Jacqueline touched on this in her presentation about every organisation's having their own sort of perspective through which they see things, and they'll mean things differently to them. But an example was when we were talking about norms and the way to act in public spaces in particular, and we were talking about how we can educate people to learn what is acceptable then, and what is I guess, yeah, acceptable in these spaces. And we were talking about education in the way of always delivering, but actually there was an organisation present who works with young people and talk about actually young people are also present in this conversation and can give education themselves as well, through not only their to each other and peers, but also to their mums and dads and grandparents or other guardians. And I think that level of different ownership of the problem and education across different perspectives is really interesting, because you always think of it and assume from one side, but actually it's likewise with the system stuff anyway. It is normally unidirectional. So I think that was an interesting thing that came out of it, is different perspectives and how they're linked.
Brilliant. Thanks, Sophie. And I know I said I was going to pick just on you, but actually, Jacqueline, while we're talking about that, you mentioned that you were part of these workshops as one of the partners. I wonder, from your perspective, how you found it. I suppose the same sort of question, where did you find any suggestions or perspectives that you hadn't thought of before, or maybe something that challenged the position that you were coming from, or any interesting sort of direct takeaways from that process?
Yeah, and it was I thought it was really good how you managed to get so many people around the room. And actually, it's true, everyone comes at this from a different perspective, and particularly if you're working in an organisation, you'll have a lens and an agenda, or how you kind of look at this. One of the things I found interesting was our understanding of language and stuff as well. So I remember being at a table and having a discussion around community safety and community policing and what is that. And I think you might have been at that table, Niamh, and it opened up a whole topic of everyone had a different understanding of what those topics were and what those things were. How do we have a joined up conversation if we're speaking at different ends, if we're coming at things with different understandings as well?
I think that's a really good point, Jacqueline, and something really interesting that came out. And I think our GroundsWell colleagues as well can attest to this across the UK, across our different hubs and centres. we come up against that as well, the different languages that we're using, or, you know, coming from different disciplines, or you know, even the idea that the word community in itself can sometimes be a bit controversial or tricky within a Northern Ireland perspective. So I think in a very meta sense as well, we've got the learnings from these individual workshops, but then we're kind of filtering them through at a consortium level too, which is fascinating, really. We have another question from Gary for Sophie, I think, about the action points. So one of the action points relates to park design specifically, and Gary is asking if this should be broadened to include other types of open space, for example, greenways or civil spaces.
Thank you. So I think in the report, because the way that we done the action points was based across the 5 groups, every group had an area that they picked specifically themselves. So I think in the context of the park design, that is in relationships to parks. And I guess as part of the next piece of research now, that one of the things that we're trying to look at is exactly that question. Can the things that work in parks and the safety aspects of parks, whether it be lighting, for instance, or CCTV, is that also applicable in other spaces as well? So in the initial conversation was identifying, so it may be a bit specific, but we're going to take them now. As Jacqueline mentioned, the next piece of work is conducting some citizen panels that we're running this month with members of the public to try and tease out things exactly like that. So that's an ongoing question. I don't think it answers specifically the question.
Thanks, Sophie. And actually, we just have a fresh question come through from another Neve this time about how there was a good range of stakeholders involved, but Neve is suggesting that there could be a wider range of women's groups, and will there be a chance for them to feed in at this stage? That might be a good opportunity to talk about, I suppose, the next steps in the process, and how that will be a factor in those steps.
So yeah, thanks, Neve. So yeah, as part of the as I mentioned, there's the systems mapping workshop was the first of a set of workshops that we're doing. So the first ones that we ran in January were with stakeholders at their initial level of, okay, what do we know? What do we envision in? Where's our initial starting place in terms of identifying action priorities? The next part is the citizen panels that I talked about that we're doing this month, that's with members of the general public. So that's involving women, men, girls and young women, boys and young men from ages 16 upwards, and engaging them in a conversation. And as following these workshops in the autumn, we are going to be doing a series of intervention co-design workshops. Now, as part of the recruitment for the citizen panels, we've already engaged with, for instance, some organisations, some women's groups, for instance, that was not in that initial list. And the list, there's almost different versions of stakeholder lists. There's the stakeholder list that showed up to the workshops, but then there's also a wider list that we consult with that is with outside that group that attended the workshops as well. So it could just be that they couldn't come to them sets of workshops, but they're frequently involved in the research, and we consult with them, and we'll be involving them in the next 2 series of workshops as well going forward.
Thank you, Sophie, and thanks, Neve, for that question. We have another question, and I suppose it would be interesting if I could get both of you to reflect on this next question, even if it does sort of specifically maybe relate to the Queen's Violence Against Women and Girls work. And the idea from Cora that we're sort of focusing at this stage on urban outdoor spaces, but how these approaches might play a role or could be applied in public spaces in rural Northern Ireland. And I suppose that's maybe not something that has come up thus far, or maybe it has in conversations, but I don't know, Jacqueline or Sophie, if either of you want to reflect on that.
Jacqueline, do you want to go first?
I was just going to say something. It's really interesting. Yeah, and as a topic that comes up, I know, and you guys will probably see it too in multiple different conversations that you're in, where it's that topic of rural versus urban when we're looking at this sort of design. And it's important to acknowledge that they're 2 very different spaces. But if it's a park, for example, a park in an urban area can be approached in the same way as a park in a rural area, and greenways will cut through both urban and rural spaces. I suppose one way of approaching it is looking at things that are similar in all of those spaces. When we talk about a lot of the stuff I hear is about dark, poorly lit spaces Access as well. We don't realise that, you know, how you actually access those spaces can lead it to feeling safe or unsafe, and whether they're well populated, well used, well animated spaces. So I suppose there are some things I imagine that can be replicated across both urban and rural spaces. Obviously, rural spaces have much more challenges in terms of how vast those spaces are and how people actually use public spaces in rural areas, but there are some things that can be used in both.
Brilliant, Jacqueline, yeah. Sophie, do you want to comment on that as well?
Yeah, I mean, I completely agree with everything Jacqueline said. I think the main thing is it might not be in terms of specifics. They might be different, as Jacqueline mentioned. The spaces themselves are different, the users are different, but the things to consider, like designing, one of the action points talks about designing spaces involving women and girls from the beginning rather than retrofitting. And I think like that is a perfect example, whether you're looking at urban or rural, that is something that should be universal between them, because it's the approach of actually designing these spaces and designing spaces that are helpful for those for everyone. A safer space for violence for women and girls is a safer space for everyone. If it's more inclusive for them, it's more inclusive for everyone. So yeah, I think that there's learnings from that can definitely be taken across to rural groups for sure.
Great, thank you both, and thanks, Cora, for that question. Jacqueline, I'd like to specifically ask you about the work with Public Health Scotland that you mentioned towards the end of your presentation and the place standard tool. So with regards to that piloting piece that you're doing and sort of applying that lens of violence against women and girls, I'm just wondering how you see the work with the place standard tool potentially benefiting communities, or where you see the potential impact, where you would like to see this go after the sort of pilot process.
Well, I think I mentioned it in one of my earlier slides, and something I would be a fan of personally in all the work I do is that idea of practical tools and practical methods that people can use to actually put policy or put some of the interventions into practice. So the place standard tool is something that is a very practical tool that can be used. You know, it's a series of questions under a series of themes. So the idea of the workshop and the engagement pilot sessions, when we do them later in the year, is about working with residents in a particular area, identifying possibly a green space that they would like to focus their attention on, going out to that space with those series of questions, those series of prompts for conversations, and really assessing the space based on all of those different things. And as mentioned, that'll talk about things like lighting, but also things like transport infrastructure, whether there's active travel options or whether there's public transport. It'll look at facilities, whether there's shops, community centres. So it's a really practical way of going through a tick list, and through that engagement session, people will be able to identify what are the areas that could be improved. But it's also a method that can be used in designing new spaces. So it's not just about retrofitting or kind of approaching spaces that are already there, but if we're going to design a new space, these practical questions can be used as a method of engaging with communities in those areas. And you mentioned it yourself, so if it's about designing these spaces right from the start, you know, working with people who are using those spaces, who are living in that area and working in that area, and understanding how they're used and how designing the spaces appropriately can make them more accessible for everybody. So I think it's a really practical tool. Once the pilot process is complete, hopefully we will have helped Public Health Scotland to tease out any final amends to that particular platform, and then we would envisage seeing it being rolled out in Belfast. I mentioned that hopefully we would be able to deliver training to a wider group of stakeholders who could then disseminate that out and carry out further engagement.
Brilliant, thank you. And as you said in your presentation as well, if the findings from this are something that you would like to share with people, or if people would be interested in hearing about this, we can certainly circulate it around the GroundsWell mailing list, and indeed everybody who registered today. So I suppose if there are no more comments or questions for the speakers, in the interest of giving people time to get a tea or coffee before their next meeting, I think I will wrap it up here. So just to say thank you everybody for joining us. If you have any further comments or questions for Jacqueline or for Sophie, you can get in touch with them directly. I think both of them had their information on their slides, but you can also get in touch with the GroundsWell team and we can pass on any requests for information. Yeah, keep an eye out for the next in our ECR and Partner series. We will be running these webinars monthly, and all of them are going to be recorded and disseminated through our GroundsWell channels. So If you have any colleagues who'd like to catch up, they can do so. We'll also aim to get an email out in the next few days to everybody registered for today with the recording, and we'll include a link to all of the resources that were mentioned today as well, so you can have a bit of a look at them afterwards. But for now, all that's really left to say is a huge thank you to both of our speakers, to Sophie and Jacqueline for presenting and leading us in discussion today, and thank you all again for joining. But for now, thanks very much and goodbye.